what if you can't get OML in the 35? You do IOML plus 7, so it would be 42. We are going to get 35. So really you're gonna go to 60 and then add 5. Okay. So I'm going to have you just lean back. So I-35, the 35 is from the 35 degrees downtown to the 315s. We're gonna use 3 twice. The first 3 is 3 inches above Nasion. So I'm gonna get to what I think is approximately there. I'm gonna go right here because I'm assuming I'm gonna tuck her chin a little bit. Sorry. Okay. Now I'm gonna take this. Sorry. And I'm gonna be tucked just a little bit. Okay, that looks pretty good. Try to go up a little bit. So the thought is that the central ray goes right through this joint, okay? Board's gonna go move just a little bit down or up, sorry. Collimation wise, we wanna get our mid-sag in the center. We wanna make sure we have light on both sides so we can get both joints. And then we can collimate pretty good because what we're looking at is just the TMJs. Put our marker off to the side here. And then I had educated my patient on closing their mouth. I'll have you bring your teeth together in the back. We'll take our picture and then I'll come back and I'll say don't move your head and go ahead and just drop your jaw. And this one's hard, okay? And then we'll take another picture. Questions on that? Okay. Okay, so that's I-35 downtown to the 3, okay? So now we're gonna use 3 again, the 315s. We will, sorry, I should have told you this, we want this vertical. So the 315s. This is an axial lateral oblique. So axial meaning we know that this is gonna have a tilt. We're gonna get our patient in a lateral. And then the oblique is we will oblique our patient, okay? So I will have you turn, face the board, get up nice and close. And then we're going to get, I'm gonna move this up. And I know that central ray is gonna be somewhere around the TMJ, right? So I'm gonna put my board there. This tube tilt, double check, 15 degree caudal or cephalic? I'm gonna brain fart. What is it? I think it's 15 degrees caudal.
Yeah.
Caudal? Okay, sorry. 15 degree caudal tube tilt, downtown, okay? What is that, Tracy? Caudal tube tilt, that's the first 15. The second 15 is once we get her set up, it'll be a 15 degree mid-sag rotation. And then the third is your central ray, and it's 1.5 inches above EAM. So it's the third 15. So I have a 15 degree caudal angle. I'm gonna get IPL good, her mid-sag looks good, and then the true lateral has IOML, okay? All of your caudal water lateral that you do that, those true laterals are IOML. TMJs is kind of the exception to the rule and it uses AML, okay? So I am going to have, we want to get AML, go up just a little bit, and then I'm going to have you come forward. Actually, I'm going to just scooch it forward. There you go. Okay, so I have, got her in a pretty good pair, or lateral. I've got my 15 degrees. I'm gonna go up because I know I need 1.5 above EAM. And before I even move her, I'm gonna move this board is gonna go up a little bit. And then I'm gonna move it want you to bring your nose towards the board a little bit. Good, the whole thing. So that's about 15 degrees. And when you do this, I want you to really feel, because you can feel your TMJ just like go flush with the IR. And that's what that 15 degrees rotation does. The other thing is it decreases OID, right? We're getting the body part that we're trying to look at right as close to the IR as we can. And then you can collimate pretty close. Roll down and put your marker right up here. Okay? Because we're looking at the downside TMJ, okay? You can relax. So the 15 degree tube tilt puts the TMJs like this, and then the rotation puts them like this, so they won't be superimposed on the picture. And then we're gonna decrease that OID as much as we can. So downtown, I-35 downtown to the 315s. You're gonna use 3 twice. Questions? Okay. That's it.